Is it even possible to predict the risk of getting a heart attack in the coming 10 years? Yes, it is. How? Let's check it out. Now, before you make any kind of assumptions, let me tell you, we are not discussing about any astrology here. We are discussing about some scientific medical calculators. These medical calculators are constructed on the basis of observations made through multiple internationally done studies. These studies involve thousands and thousands of patients, and on the basis of whatever observation has been made in these studies, these calculators are constructed. In this video, we will be discussing about such medical calculator known as the Ascvd Calculator, or the recent version which is known as the Ascvd Estimator Plus Calculator. This calculator is endorsed by the American College of Cardiology and the American Heart Association and many such international medical associations. So the link for this calculator I will be posting here in the description of this video. Apart from that, apps based on this calculator are also available in the Google Play Store and also the Apple Store. Two very important things that you need to keep in mind while using this calculator. Number one, this calculator is meant for risk estimation for people who are in the age group of 40 to 79 years. If your age is beyond this limit, then this calculator is not for you. The second important thing that you need to take care while estimating the risk in this calculator is that this calculator is meant for those people who never had a heart attack or any cardiovascular episode like stroke in their life. And this information is mainly, number one, your blood pressure and both the parts of the blood pressure, the upper one and the lower one. The upper one known as the systolic blood pressure, the lower one known as the diastolic blood pressure. So when we say the BP is 120 by 80, then 120 becomes the systolic blood pressure and 80 becomes the diastolic blood pressure. You can use any digital blood pressure apparatus to get these readings for you. The second thing that you need to be prepared with is your cholesterol report, and we call it as the lipid profile report. You can get it done at any of the labs available nearby you, and from there you will get the necessary values which are required to be put into this calculator. Now the most important part, how to use this calculator. So as you can see in this figure, this is basically a screenshot of the calculator taken from a computer screen. You can see here there are multiple parameters starting from the top, the current age. Here you will have to obviously fill your age, select your sex, male or female. In the race, for Indians you can select the other option. Then your systolic blood pressure, as I told you, in your blood pressure the upper reading or the upper number is your systolic blood pressure, and then the diastolic blood pressure, which is the lower number. Then fill up from your lipid profile report your total cholesterol value, HDL cholesterol value and LDL cholesterol value. After you do this, the next is the question about history of diabetes, yes, no, smoker, yes, former, no, and then hypertension treatment, whether you are on hypertension, that is high blood pressure treatment. Then are you on statin? What do we mean by statin? Statin means the medicines which are given to reduce the cholesterol. To know this, you can just see whatever medicines you are already on. You just read the composition on the packet of those medicines. If the composition says something like atorvastatin or rosuvastatin, then it means that you are taking statin medicine. If none of your ongoing medicines are labeled with this kind of composition which contains the word statin, then it means that you are not on any statin. And the last one is whether you are on aspirin therapy. Again, if you are on any medication, just flip the packet and see what is written in the composition. If the word aspirin is written there, then you are on aspirin. If it is not, then you are not on aspirin therapy. So this is how you have to just click and fill up this form, and once you fill up the form, then you can see at the top you will get the estimation of your risk or the percentage of your approximate risk of getting a cardiovascular episode in the coming 10 years. This is given in terms of percentage. The option at the bottom, do you want to refine the risk? This you need not fill it up. It is for the physician who is following up you using this Ascvd score. So you can just leave this last option. As you can see in this figure, If your score is less than 5%, it means that you fall in the low risk category. If your score is anywhere between 5 to 7.4%, it means that you fall in the borderline risk category. If anywhere between 7.5 to 19.9%, it is something known as the intermediate risk category, and anything beyond 20% is known as the high risk category. Now, what to do about this score? If your score is low risk category, then it means that usually you do not need any medicines for further management in your case, and most of the time only lifestyle modification like a good diet, then exercise, all these things, and including cessation of smoking, tobacco, all these lifestyle changes should be good enough for you to bring down your risk score or to keep that in control. But if you fall in the category higher than this, that is whether it is borderline, intermediate risk or high risk, then it means that you may be required to be started on the cholesterol reducing therapy and other measures, other medicinal measures, and for this you have to go and meet your doctor. But please remember, this risk in terms of percentage is not absolute, which means that it's not sure shot that you will definitely get a cardiovascular episode in the coming 10 years or not. It's not anything absolute like this, but this just gives you a guidance about how you can manage yourself in terms of lifestyle management, or probably needing the medicines to reduce your cholesterol. So how you can manage your health so that your risk of getting a heart attack or a stroke is reduced. Number two, if you keep on serially doing your this scoring and getting percentage, for example, if you are doing every say 6 months, every year, then you can be in a position to estimate whatever measures, lifestyle measures or medicinal measures have been started to you, whether they are really effective, whether they are really reducing your score and improving your cardiac health or not. So for such estimation of progress, this score can be used. I hope this video was useful. So use the calculator and calculate your cardiovascular risk right away. And if you really find this information useful, then do share this video with all your friends, colleagues, relatives, everybody, for everybody's benefit. And if you have any comments, any questions, any suggestions, please post in the comment section below.